it's been tough with so many vaccines in use right now, as well as so many new variants. Which ones might be effective against which variants? What's the latest that we know?
Oh, it's all really confusing, isn't it, Michelle? And trying to keep up with it is definitely something that, for the public, it's a challenge. And then you do have comments like this from the Mayo Clinic, which are worrying, because you do think there's a race to vaccinate everybody with the vaccines we've got at the moment before the virus mutates. And is it possible that eventually, if not enough people are being vaccinated, either because of a lack of uptake, a lack of the vaccine in many of the lower income countries, what impact is that going to have? So I was speaking to Professor Paul Hunter this morning, Professor of Medicine here in the UK, but he's also a consultant for the World Health Organization. He's not quite as pessimistic as it would seem coming from the Mayo Clinic. He says, obviously, here in the UK, as you said, we've got this Delta variant, as we've now reclassified the Indian variant. It's called the Delta variant. As you said then, it's definitely more transmissible. Is it more lethal? We don't know, because of the amazing uptake of vaccination here in the UK. The people who would probably be most vulnerable to being hospitalised or dying from any new variant have been vaccinated against it, and it seems that the vaccines are working. Now, Professor Hunter explained something to me, so be slightly prepared for a science lesson here. The thing is, you have something called a mucosal infection or a systemic infection. The mucosal infection is in the nose and in the mouth, and that's what the coronavirus COVID-19 is causing. It becomes systemic if in certain people it then goes deep into the body and affects organs, is much more dangerous. And it seems all the vaccines are definitely protecting people against this systemic infection. And Professor Hunter thinks this immunity is going to be long lasting. So he doesn't think we're going to end up having no vaccines working against future variants at the moment. He also said that the virus mutates quite slowly. This is common with all coronaviruses. So it could be between 7 and 20 years before it becomes an unrecognisable variant to what we have today. And he thinks that our immunity is long lasting. And so he does hope that as long as people are vaccinated, then they definitely will be protected. But as you said, the main aim is to ensure that we get these vaccines to people in the world where they're available, and that we share them into parts of the world where they don't exist at the moment.
And the hesitancy that we continue to see in some countries more than others, did that take scientists by surprise, that here quickly we have vaccines available? Did they expect to see so many people saying no or being afraid? And how does that play into the rise of variants?
I think that's a really good question. In fact, scientists are quite surprised at the uptake, because apparently vaccine hesitancy is one of the biggest global health threats to the world. And many countries which are even incredibly hesitant, say France, to other vaccines, have seen a higher uptake than you can imagine. But it also depends on the people. I've been covering this story for a year for TRT World. To me, it's a bit of a no-brainer. Vaccines have been developed so amazingly. The research is wonderful. Protect yourself against this. But I've been speaking to people, particularly those working in the gig economy. So I was talking to a cleaner who said that she didn't want to get vaccinated in case the side effects meant she couldn't work. So I said to her, look, I can tell you for a fact, coronavirus will prevent you from working for a lot longer. But she couldn't be persuaded. And similarly, an Uber driver told me that he was incredibly fit and healthy and he wouldn't get COVID-19. And again, I said to him, what about the long COVID? A lot of healthy people have been ill, but he still wouldn't be shifted. There's an impossibility in certain people's mindsets. So how do we overcome that? Now, there's a big debate at the moment. Do we make it mandatory? Being discussed here in the UK, whether all NHS workers should be vaccinated, people who work in care homes have to be vaccinated. Is that the way forward? And that's looking likely to be introduced. In America, we've got bribery. So in one state, in Ohio, they've got 1 million lottery tickets. And they're basically saying, get vaccinated and you can enter this lottery. And in other places, for students, they're saying you get free student housing if you're vaccinated. Lots of debates going on how we can persuade people to take these vaccines.
We saw a tweet yesterday of someone pretending to be angry, saying, I was told I would get a 5G free internet card for getting this vaccine, and all I got was near complete immunity to a deadly disease. Thanks to Nicola for that.